Hi guys, my name is Hardas. I'm a board certified OBGYN and a cosmetic gynecologist, and one of my passions is education. So today I decided to talk about fibroids. Most of you must have heard about fibroids, right? Fibroids are the benign tumors of the uterus. They are so common that I would say 50 to 70% women sometimes in their life will be diagnosed with fibroid. They are more common in Afro-American women as well. So fibroids are also called as leiomyomas, and they grow from the muscle part of the uterus. So the uterus is made up of outer layer, which we call serosa, the muscular part, which is the wall of the uterus, and the cavity. So these tumors, they grow into the muscular part of the uterus. Now they can grow at different places. Looks irregular and weird just because these fibroid tumors are growing in there. So this is the uterus, these are the fallopian tubes, and these are the ovaries. Now these are the fibroid tumors which are growing in there. The tumors which grow towards the cavity of the uterus, we call them submucous. Those which grow into the wall of the uterus, they are called intramural. And those who grow kind of on the outside, like popping out this way outside, they are called, like these ones, they are called subserous. Now some fibroids, they grow out and they are like hanging out on the uterus with a stalk or a pedicle. These are called pedunculated fibroids. I know they kind of look scary, but they are benign. Let me assure you that 99% of these fibroids do not convert into cancer. So you don't have to worry about it if you have a diagnosis of fibroid. Now, how would a person know they have a fibroid? Most of the women are asymptomatic. The reason they get diagnosed is because they had an ultrasound done for some other reason also. But fibroids sometimes can cause symptoms. They can cause heavy and irregular bleeding. They can cause intermenstrual bleeding, that means bleeding in between the menstrual cycle. Sometimes they can cause bleeding after sex. They can cause pressure symptoms. Now you can see that when they grow, they can cause pressure. Now I want to show you a picture of different sizes of the fibroid. So this is just to give you an idea how small or a big a fibroid can be. It can be as small as a tiny little seedling, and it can be as big as a watermelon. And there are all shapes and sizes you can get. So obviously the symptoms depend upon the shape and the size of the fibroid. If they are tiny fibroids, you're not going to have any symptoms. If they are large fibroids, they can cause pressure symptoms. Pressure on your bladder, so you're going more frequently to bathroom, or you leak urine, or pressure when during sex it might be a little painful. The pressure on the bowels can cause constipation as well. So the symptoms really depend upon where the fibroids are and how big they are. Now anytime I tell a patient that you have a fibroid tumor, one of the common concerns she has is that, is it gonna make me infertile? Now, can fibroid cause infertility? Good question. But the again answer depends upon where the fibroid is and how big it is. Tiny little fibroids not gonna do anything. Fibroids which grow on the outside, like subserous one or a pedunculated fibroids, I showed you a picture earlier, they don't cause any problem. But the fibroids, if they are very large and they are closer to the fallopian tubes, they can cause obstruction or a blockage of a fallopian tube and cause infertility. So it really depends, where it is. Same with the pregnancy complications. Most of the people worry about, oh my goodness, if I get pregnant with fibroid, am I going to have miscarriage? Am I going to have preterm labor? Well, again, it depends where the fibroid is. The bad ones are we call submucous, the one which are towards the cavity of the uterus, because they can change the shape and size of the cavity where the baby is gonna grow, number one. And number two, if the placenta gets implanted on the top of the fibroid, it may not get enough blood supply, and then you could end up with a miscarriage or a preterm labor. Most of the fibroids during pregnancy, they kind of get flattened out and they get on a side, baby grows, nothing happens. But sometimes the fibroids start growing, and it grows so fast that it will not get enough blood supply. The uterus cannot keep up with the blood supply, and that's when something called a degeneration happens. That means that the part of that fibroid starts dying. It's called red degeneration of the fibroid, and if that happens, you have a lot of pain. And in pregnancy, then we have to do a pregnancy management for pain as well as premature labor at that time. So pregnancy complications again depend upon the shape and size of the fibroid. Now, how do you diagnose fibroid? It's usually, as I told you, you have an ultrasound done, either for some other reason because you had pain, or you are having excessive bleeding, irregular bleeding, pain during sex, and your OBGYN does an ultrasound. So once the ultrasound is done and you have a diagnosis of fibroid, does that mean you need a treatment? Not necessarily. Only if it's a symptomatic fibroid or a large fibroid, or it's causing problems like infertility, or you had a preterm labor or a miscarriage and we think the fibroid is the reason, and that's when we go after a fibroid. Now, how do we treat a fibroid? There are different ways of treating a fibroid. We usually start with medical management, and medical management can be a birth control pill, it could be an IUD with a progesterone, or there are some medications, they are like injectable medications which are given to cause the fibroids to shrink down. Now, what are these medications? There are a few on the market, and the whole idea behind giving this medication is that the fibroids depend on the female hormones for the growth. So if there are no hormones, the fibroid will stop growing and eventually shrink. So these medications we give, they kind of sort of put you in a artificial menopause. That means they take your estrogen and a progesterone away, and that will make the fibroids to shrink. So it's a temporary, but it does help some people. Now, there are some surgical and non-surgical options as well for the treatment of a fibroid. One of the non-surgical option is called UAE, or a uterine artery embolization. So this is a picture just to give you an idea about the UAE. What happens, like this is the fibroid growing in there. It's a procedure done by an interventional radiologist. They're gonna go through one of your veins in your groin area. They put a catheter through this vein which will go to the fibroid, and they will inject something which will block the blood flow. So they will block that blood vessel. So what's going to happen is that the fibroid will not get any blood, and if it doesn't get blood, it can grow and it will shrink down. So it's an outpatient procedure done under sedation, works out pretty good. Now, the other minimally invasive procedure to get rid of a fibroid, it is called Acessa. So Acessa procedure is a laparoscopic procedure where we're gonna put in a camera in your belly, and we're gonna look for these fibroids with an ultrasound. So we use an ultrasound probe inside the belly to find out where the fibroid is, how big it is. And then we put in an instrument. It has a radio frequency waves. It's like a needle kind of a thing. Goes into the fibroid. See here? It's going into the fibroid and it burns the fibroid. So you can burn as many fibroids as possible that day, and how much radio frequency waves and how deep we have to go depends upon the shape and the size, and it is calculated by a computer. So it's a great procedure for a person who does not want like a hysterectomy or big surgery done, having the symptoms with the fibroid and wants to get rid of the fibroid. So this is a minimally invasive procedure. The other minimally invasive procedure is called hysteroscopic myomectomy. So hysteroscopy means putting a camera inside of the uterus. So you go vaginally, you put in a camera inside of the uterus. Now this works out really good for those submucous or fibroids which are inside of your, like in the cavity of the uterus. So we pass in an instrument and we cut and remove the fibroids from vagina. So it's kind of like a DNC procedure where you have it, we put a camera, take the fibroid, come out. Works out really good for those fibroids only. Now, what about the fibroids which are into the wall of the uterus or outside? We can do the myomectomy, but that can be either done laparoscopically or laparotomy or opening the abdomen. So with the myomectomy, what we do, either laparoscopic procedure or open procedure, we're gonna go in the uterus, cut the uterus, take the fibroid out and stitch it back in again. Again, you can remove a lot of fibroids this way. This is a great procedure for a woman if she wants to preserve her uterus because she is interested in further fertility. So myomectomy is very popular for that age group patient. The fibroids are very big, and you are done with your childbearing, and they're causing a lot of symptoms. Hysterectomy can always be offered as well. Again, hysterectomy can be done open, which is you have to do a laparotomy and open the patient. It can be done laparoscopically, it can be done vaginally, or it can be done robotically as well nowadays. So which treatment is gonna be a right treatment for you? And there are so many options. What is gonna be the best choice for you will depend upon you and your obstetrician and your gynecologist. So if you have symptoms of fibroids, or if you are looking into the treatment for fibroids, please talk to your gynecologist and get their advice on it.